Tonight, my guests are two Nigerian Christian scientists who have developed a COVID vaccine that has gotten onto the WHO list of preclinical trial vaccine candidates. We talk about their wonderful project and they answer questions about all the fears that are going all about the COVID vaccines tonight on Chim's Talk Africa. But before we do that, please like this video and leave a comment below. Let's know what you think. And don't forget to subscribe and click on the bell button and share this video with somebody else.
From Cape Town to Cairo and from Mogadishu to Dakar, this is Chim's Talk Africa. And now here's your host, Chim Onyibilanma.
Hi there, welcome to your weekly show, Chim's Talk Africa. I'm your host, Chim Onyibilanma. Thanks for joining us. I know you will find my interview and conversation today with these two brothers who are scientists very interesting, informative, as well as inspiring. But before we go into that, we're going to go into the segment of our show that is called Teaching Time. And Pade Tokun from Ibadan, Nigeria, will continue the teaching he started last week. Pade, over to you. Thank you so much for being a blessing to us last week. Over to you.
Thank you, Chim. Jesus was talking to multitudes of people that followed him, people that came to hear him. They decided to hear him because they believed there was something they were going to get out of hearing him. And to the multitude, he said in Matthew chapter 7, I read verses 13 and 14. Jesus said, enter by the narrow gate, for wide is the gate, and broad is the way that leads to destruction, and there are many who go in by it. Because narrow is the gate, and difficult is the way which leads to life, and there are few who find it. He was talking to multitudes that came to hear him. And he said to them, it was an admonition, an injunction to people that claim to believe on him. Enter at the narrow gate. And I can say that even today, and to multitudes today that claim to belong to him, he said to them, enter by the narrow gate. You know, those people that were following him by their choice, but the Lord knew there was something that they must do. They must enter by the narrow gate. And when somebody claims to belong to Jesus, when he claims to be a Christian, when he identifies with the church, Jesus is saying to him, enter by the narrow gate. That is, according to Jesus, there are two gates. There are two gates. There is the narrow gate, there is a wide gate. And he's saying to people, enter by the narrow gate. And from this passage again, he's saying, the narrow gate opens to the narrow way that ends in life. The wide gate opens to the broad way that ends in destruction. Each gate opens to a way and ends up in a specific place. So when a person enters the wide gate, he's automatically going to walk on the broad way, and it will end up in destruction. When somebody does not want to end up in destruction, he must not enter through the wide gate. Once you enter through the gate, the road in which you are going to find yourself is fixed. And once you are on a road, your destiny is fixed. From what Jesus is saying, it is not possible to enter through the wide gate and find yourself to end up in life. It is not possible. Once you enter through the wide gate, you cannot end up in life. You can make the choice of gate, but you cannot make the choice of your end. You have the liberty to decide which gate, but once you make that choice, your end is defined. Once you choose the broad way, your end is defined. If you choose the narrow way, your end is defined. You know, someone could have decided to walk on the broad way, and he gets to a point, he sees the end, destruction, and is afraid. The Bible describes graphically the fear of such a person that has chosen the broad way, he has chosen the wide gate and the broad way, and he sees the end of destruction, and fear grips his heart. In Proverbs chapter 1, hear what God says. In verse 26, he said, I also will laugh at your calamity. I will mock when your terror comes, when you become afraid. When your terror comes like a storm, and your destruction comes like a whirlwind, when distress and anguish come upon you, then they will call on me, but I will not answer. They will seek me diligently, but they will not find me, because they hated knowledge. Now you are getting knowledge. And what is the knowledge? There are two gates. Choose the narrow gate. You will end up on the narrow way and end up in life. Don't choose the wide gate, because it will open you to walk on the broad way, and you will end in destruction. And Jesus said, that is why Jesus said, enter by the narrow way. God bless you.
Thanks so much, Paddy. Now, if you are like me, I'm sure you'll be asking, what is the difference between the broad way and the narrow way? Well, you have to tune in next week, because next week, that is the question that Paddy will be answering as he continues this teaching, the difference between the broad way and the narrow way. But right now, we're going to go over to these two brothers who are scientists in Nigeria, and we're going to enter into this conversation about the COVID vaccine they have developed, and I'm going to introduce them now as they join us over Zoom. Professor Kola Oloke is a professor of microbiology and biotechnology, and is also the vice chancellor of the Precious Cornerstone University in Ibadan in Nigeria. That is in the southwestern part of Nigeria. Professor Kola is one of the renowned or leading experts in Nigeria in the field of microbiology as well as biotechnology, and he's presently the coordinator of the team of scientists that are working on this COVID vaccine that is in the preclinical trial stage. Professor Oloke, you are welcome to Chim's Talk Africa.
Thank you.
With him is Dr. Oladipo Kolawole, who is an international fellow with a PhD in medical virology and immunology, and he's a lecturer at the Department of of microbiology at the Adeleke University, also in the southwestern part of Nigeria. Dr. Oladipo, you are welcome to the show.
Thank you, sir.
Now, I checked the World Health Organization's website today, and I was so impressed that out of the total of 175 vaccine projects from around the world that have been accepted as qualified to be listed in the preclinical trial stage on the World Health Organization's table, yours is the only one, apart from one from Egypt, that is from Africa. That is a big feat. Dr. Oladipo, how does this make you feel?
Well, I felt so happy when we made the list because it's not something we planned for or we dreamed for. We're just trying to do our best by the grace that God has given to us. Based on what we did alongside with my mentor, Professor J.K. Uluke, the news went viral at that time on national dailies and social media, and the WHO got across to us from the headquarters from Geneva and asked about the methodology and some technical questions from us, and we supplied them with those technical questions around August last year. And since then, they included our vaccine candidates into the list of WHO draft landscape for COVID-19 vaccine candidates.
Wow, Professor Oloke, I say praise God, and I feel so proud as an African because you guys are able to do this. I understand there's a lot of scientists from various institutions working on this particular project. Can you give us an idea, Dr. Oloke, of how your team all came together and what it means for your vaccine, as we've just said, to be listed as being in the preclinical trial stage?
Yes, when we had the pandemic, COVID-19 pandemic started last year, we came together and we felt that we should not just fold our hands. So we gathered people together from different universities, from Precious Cornerstone University, Ibadan, from Adeleke University in Ede, Nigeria, from Ladoke Akintola University, and many other universities in Nigeria, and then from some private laboratories and medical outfits. The preclinical test is the use of to test the effectiveness of the vaccine in animal, because this is what will give us a clear picture of how the vaccine will perform when it is used for human. So simply put, the preclinical testing of vaccine is testing for the efficacy and safety of the vaccine using animals.
Dr. Kola, so far, how effective have you found this vaccine that you have created to be, these vaccine candidates?
The vaccine candidates really looks promising, and it's too surprisingly, we have tested our construct as against the circulating mutant that we have now, and it have like 70% coverage for that too, because we are trying to make our own contribution in our own little way by the special grace of God given it to us.
Dr. Oladipo, according to the World Health Organization information I got, your vaccine candidate is said to be a protein subunit vaccine. That's the type it is. Whereas I understand that the Pfizer vaccine that is presently being used, as well as some others, the ones that have been administered in the US and around the world, they are called, they call them the mRNA. That is the messenger RNA vaccine. What is the difference between your type and that type? And there are a lot of stories flying around making the rounds, and it's quite fearful of what people are talking about this mRNA. What is the difference?
Okay, the difference there is the method of the development of the vaccine. What we did was that we want to use the known platform for a new disease. So what they did was a new platform for a new disease. All those platforms are effective, but we just felt from our own end that using a known platform for a new disease will give us a full grasp of this thing. Then we are looking at a way by which we are in Africa So we are looking at our context in the sense that we want to look at something that is achievable with the little raw material that we have, so that we will not be dependent totally on the Western world. All those vaccines will be effective, but we having the technology with us will save us a lot of money in terms of Africa. And it's why we have the technology now and everything. There are a lot of other diseases that needed vaccine that is not COVID-19 alone, that we can even deploy that methodology. So far, even in the team, we have young scientists there. We are like 40 in number that are working. So we included capacity development into what we are doing too, so that we can have upcoming generations that the technology can be transferred to and try to work on it. But let me tell you, another truth is that the messenger RNA vaccine cannot go into our DNA and disrupt anything like people are saying. The science doesn't work that way. So science is not working that way. So, but people are just been talking about the storage. Their own temperature here in tropic regions does not support that, because there are a lot of logistics in order to maintain the cold chain of the vaccine. That's why we are trying to see. Like, I can tell you that everybody is conversant with hepatitis B vaccine. They take hepatitis vaccine. So it's the same template that they use for hepatitis B that we are using for this. And don't forget that outside the world, we have influenza virus in US, some other part of Western world, and the vaccine is not constant. As the virus keeps changing, they update the vaccine. So what we are saying is that once we have our own technology and we have our vaccine candidate approved, even if there are mutations occurring, we keep on updating our candidates, not waiting for another company outside to come and do that for us. Because now we are saying that there are some different variants of those images that are circulating in different regions of the world. Though a particular vaccine might have an effectiveness over a mutant strain, but may not have the percentage higher compared to where it was actually developed from. So there is nothing to worry.
Dr. Oloke, I see you smiling. There are many stories going around about vaccines today, and I want us to talk about this. Some people are saying it's the mark of the beast that they want to give us through this vaccine. Others talk about a plan to depopulate Africa and bring about population control through these vaccines. Others claim that the mRNA vaccine will turn us into robots. You are a strong believer in Christ. I've known you for over 30 years. I know I can trust your conclusions as a scientist as well as a man who loves Jesus. Please tell us, what do you say about all these different theories that are flying around?
Yeah, as he said, it's interesting to see how people come up with views based on their perception. And it's known that people's perception could be very, very faulty. You see, the only thing that we should be talking about, and you mentioned it before we started, that ordinarily production of vaccine often takes a very long time before it is declared safe. So, but because of the emergency, that's why it was not possible to undergo all the things that needed to be done. And but you see, it's still possible because people are dying, and we have to save the world from this pandemic. So let us be encouraged. Let us be encouraged. People that, especially in the advanced country where we have very cold temperatures, for now they have no option than to use this vaccine. And thank God for this kind of development too in Africa that we have. And we have to encourage this one too. And as I said, who knows, the vaccine from Africa may play a major role in even helping them in the advanced countries. So people should have a rest of mind. Some of these theories are faulty and they have no basis.
Dr. Ladipo, there's something called the Luciferian enzyme that many claim to be added to some of these vaccines, especially the Pfizer one. You know, that word sounds like Lucifer, and they say they are planning to use it to mark us for Satan. What do you know about this Luciferian enzyme?
Prof has worked extensively on enzyme, so I want him to answer that.
You see, when I read it, I laughed. Luciferian enzyme is the enzyme in this firefly that makes them to produce light, and so it's the enzyme that makes the firefly to emit light. And even if it is incorporated into anything, it is to serve as a signal. It's like a signal. If you can make the insect to produce light, so it can serve as a marker, as a signal. So it doesn't have anything to do with Lucifer at all. That is just the name of the enzyme based on the substrate that it catalyzes. So it doesn't have anything to do with Lucifer at all. And for our own vaccine, there is no Luciferians.
Gentlemen, this is such a laudable project, and you say your biggest need is fund to get it out to help the population. What is your government as well as the AU doing? Do they know about what you're doing, and what are they doing about it? Also, I want you to tell me, what do you think churches as well as individual Christian men and women, businessmen, businesswomen, what can they do?
Right now, the truth of the matter is that there is nothing substantial from the side of the government, but through different means we have been able to send information to people that we feel matter, and we are hoping that something will come up and they'll be able to support us. And so we are still using this medium to appeal to the people that matter, the Minister of Health and all other people, to please come to our aid. They can come to our aid by assisting us in the preclinical trials that we are doing, and also in the clinical trials, and to also assist us in the different aspects of this vaccine. So Dr. Ladipo will talk about this.
The church has a role to play in this thing. Like, that's one of the things that motivated us, that they're seeing a lot of theories coming out that they want to destroy people, kill people, reproduction, all those kind of theories that are not well proven. But the fact still remains, if we have Christians, there are scientists. They should be able to do what is right. And that is why we scientists, Christian scientists, we have come together and do something that we can say boldly. This is the methodology, and this is what they have at the back of our mind. We are not controlling any population. We are trying to solve, and we should be able to see the support of the church. Like when they were building the wall of the Jericho, and they were building the wall of Jerusalem that time, we discovered that some people were building the wall. Some have the gun, the spear, every other thing. As the church is praying, I believe in faith that God can keep us away from COVID-19. But that doesn't stop us from using science also, and the church supporting science for us to get this thing, because it's God that gave us the knowledge. And it's not that we can solve the problem through that knowledge. That was why God have given the knowledge to us. So we're also soliciting for the support of different churches and different pastors that could come up and support us in all areas of this research.
And to add to that, there could be some members of the church who want to invest in this business, because vaccine business is a profitable business. As Dr. Ladipo said, it's not only COVID-19 that requires vaccine. There are so many other diseases, and we have the technology with us, with the support of other people. We have the technology with us. And it's not only COVID-19 vaccine that we are working on. We are trying to produce vaccine for other things like Lassa fever, hepatitis E, and so many other things. So although it's difficult for us at a start like this, but we believe there's a future for it. So if you have people, members of the church, who want to invest, this is an opportunity for investment. So, and people should not be afraid to invest. That's why I talk about other things, other vaccines that we have planned to construct. So it's not only COVID-19 vaccine. We are not limiting ourselves to COVID-19 vaccine in our group. So there's a good future, and there's a good return for investment. Thank you.
Thank you so much, gentlemen. You are so correct. This is the answer to many of us Christians who are thinking that, look, this demonic worldly scientists, they are trying to use this vaccine to pass around some harmful things. No, I would say, why don't we now gather together and support Christians like you who are scientists? Not only that, your work has already been given a thumbs up by the World Health Organization, and you have the same values as us Christians. Isn't it something that we can all come around together and make sure that those who have the right value and have been anointed by God, skilled by God to produce this kind of things, can actually get it out? You know, I'm really concerned that why should our government in Africa be spending millions to order vaccines from outside, from the West? The money we can use to do things at home, whereas we can fund our own homegrown vaccine. Why should we once again tie ourselves with the West, whereas we have scientists here who are bringing solutions? Why can't Africa bring a solution to a global problem? It just tears my heart. But I want to stop here, brothers, and I thank you so much for the great work you're doing. And I want to ask those who are interested in getting in touch with you or getting involved with what you're doing. If you're watching this program, you want to get involved with them, you're a scientist, or maybe you want to fund it, you want to invest like Dr. Oloke has said in this project, or you're a church that wants to get involved, please use the information on the screen. This is something you need to get behind. Thank you, gentlemen. God bless you. This is where we will stop. Thank you. That got me really passionate. I mean, you will agree with me, having this kind of thing being done by Christians is inspiring. God is the God of all truth. All science, true science belongs to him. So he anoints people to do this. So thank you so much for watching the show. If the show has been a blessing to you, please consider partnering with us to take the gospel to the ends of the earth. Your generous giving will help us to touch more lives and equip people in the church. As a thank you to you for any gift you give towards this ministry this month, I want to send you a copy of my latest book. It is called God Gives His Children a Song. This is a book that has impacted and transformed lives around the world, and I want to send it to you. If you will give a gift, if you would support this ministry in any way this month, we want to say thank you to you for doing that. Please use the information on the screen to get in touch with us if you would like to support, and I'll see you next week if the Lord Jesus Christ has not come back by then. Thank you so much for joining us, and bye-bye for now. Bye. Please like this video and leave a comment below. Let's know what you think, and don't forget to subscribe and click on the bell button and share this video with somebody else.